Hey there, I'm Rob, the registered nurse who'll be walking you through this training today. I'll tell you a little bit about tobacco use in the United States and the role that we in the clinical care team play. Then, you'll see various scenarios between a few key players, including the medical assistant, provider, and patient, along with learning about the importance of asking, advising, and referring patients. You'll be trained on how to use the main sections of the tobacco intervention template. So, to start us off, did you know? Every year, tobacco kills more Americans than do AIDS, homicide, vehicular accidents, suicide, drug use, and alcohol combined.
In the U.S., smoking is responsible for about 1 in 5 deaths annually. That's approximately 480,000 people who die per year because of smoking. Additionally, an estimated 41,000 or 8.5% of these smoking-related deaths are the result of secondhand smoke exposure. In Texas, 15.7% of the adult population is a current smoker. That's more than 4 million people, and over 28,000 die as a result every year.
Did you also know? We all have a vital role to play in helping people quit tobacco. Brief advice about smoking cessation can increase the chance of quitting by 66%. And yet, why is it hard for health professionals to talk with patients about tobacco use? Because it's tough. Judging by this conversation during the morning huddle between Dr. Bailey and the medical assistant Sue, there are several things that make it really tough. But there are also several things that make it really easy and effective.
Hey, Dr. Bailey. At your 10 o'clock hour, Mr. Martinez will be here for his diabetes follow-up. But on the schedule, it looks like he's going to want to talk about his back pain, too. Oh, I just don't have that much time. I'm already double booked. Yeah, that appointment's going to be tight then, because he's a tobacco user, too. So we'll need to address that as well. Yeah, I know. But I've talked to him before. We talk about it at every visit. I know, right? But if we don't bring it up every time, he won't think it's a big deal. Trust me. I'm sure Mr. Martinez would appreciate us asking him about his tobacco use. Well, he does get frustrated every time I bring it up. But I have read studies that say even just 2 minutes of brief advice can help motivate patients to think about quitting. You know what, Dr. Bailey? I remember you telling me that it can also take up to 7 times to quit. Let's see if he's ready to be referred to the quit line.
Referral to the quit line is super easy using the eTobacco protocol. It's built into your electronic health record, or EHR. An electronic health record is an electronic tool to help healthcare providers simplify the patient's intake process. The eTobacco protocol template lets clinicians refer tobacco users to the quit line following an ask, advise, refer framework. The actual template pages might look different depending on the type of EHR software your system provides. First, let's go through what the intake part of the template might look like for a patient like Mr. Martinez. This first screen shows us that there's an option for reviewing and updating the patient's smoking status. Here we can record information such as the type of tobacco product used and how much the patient smokes.
So, Mr. Martinez, I know that you're here to talk about your diabetes, but let me first update our records. I see you've told us before that you're a smoker. Is that still the case?
Yeah, I am. Once we know that the patient is a current smoker, we can use the eTobacco template. The template allows us to indicate whether the patient is ready and willing to quit, whether the patient consents for referral to the quit line, and whether counseling has been given or discussed. This screen shows us that we can use the eTobacco protocol to make a referral for our patient.
All right, let's talk about your smoking, Mr. Martinez. How do you feel? Do you think you're ready to quit?
Well, I think about it all the time, but it's too hard on my own. Maybe I should switch to spit tobacco or those fancy e-cigarettes I keep hearing about.
Well, spit and smokeless tobacco can actually cause a lot of harm too. For example, they could lead to cancers of the mouth and even the pancreas. When it comes to e-cigarettes, while they are potentially a better alternative to smoking or other tobacco, some research found that they still damage the lungs. There are fewer chemicals in the electronic cigarettes, but they still contain many harmful toxins, including nicotine, heavy metals like lead, and cancer-causing agents. Also, many people just switch, continuing or even increasing their nicotine dependence. I really want to help you try to quit, using support that has been proven to be effective. How about it? Do you think that's a possibility in the next 30 days?
I want to, but I just don't think it will work. I've tried before.
I completely understand that. But have you ever been part of any tobacco counseling programs? A quit coach could actually make a difference this time.
A quit coach? Wow. That sounds too expensive.
Well, actually, it's all free. If I can make a referral to the quit line, you can get some help and support to become successful.
Ooh. Okay. How do we do that?
Let the patient know that the Quit Line is a free phone-based service that is also available online. It provides multiple one-on-one counseling sessions that come with a quit coach for patients 13 years old and older. Patients can also call whenever they're having cravings 24 hours a day, 7 days a week. Patients 18 years old and older can also get at least 2 weeks of free nicotine replacement therapy. And the Quit Line even provides information about support programs available within the patient's community.
So now, let's get back to the exam room and see how the MA talks with Mr. Martinez.
Is it okay for the quit line to contact you?
Yes, that's fine.
Great. Now you can look forward to the quit line calling you within the next 3 days to get you enrolled. So it's really important that you answer their phone call. And if you miss a phone call, remember to call the quit line back.
Okay, I'll make sure to do that. And now, Dr. Bailey will get a chance to talk with Mr. Martinez using the tobacco intervention template. So, what can she or any other provider do if the patient is in fact ready to quit? In many EHRs, the provider will first see an alert that indicates his patient is an active smoker who is ready to quit and wants to be referred to the quit line. If your EHR doesn't provide an alert, be sure to find out where required tobacco status is documented. It could be someplace like the patient's social history. Let's see how Dr. Bailey approaches Mr. Martinez with this information.
So, Mr. Martinez, I see that you're ready to quit?
Yeah, I guess.
That's fantastic! Woohoo! Have you tried to quit before?
Yeah, I've tried to go cold turkey, but haven't been able to quit completely.
That makes sense. It usually takes 5 to 7 tries for someone to quit.
Yeah, but come to think of it, I probably have tried that many times. It's always back and forth, you know?
Well, research shows that people who use nicotine replacement therapy have more successful quit attempts.
What's that? Do you mean like nicotine gum or something?
Yep, that's exactly right. Like nicotine gum and the patch. Those are pretty popular.
Oh yeah, I've used nicotine gum before, and even that didn't work.
Yeah, unfortunately, we find some people don't use nicotine replacement therapy correctly, usually because they don't take it long enough. But I see here that you wanted to be referred to the quit line. They can make sure that you're using everything correctly. Also, they provide great counseling to help you manage your cravings.
Okay, Doc. I trust you. Okay, so many of us might be thinking that patients' visits don't all work out so well. For instance, what if the patient says, no, they're not ready to quit? Keep in mind, any member of the clinical care team can face this situation. In the role play you're about to see, Dr. Bailey knows through way of an alert or a clinic-specific method that Mr. Martinez is an active smoker who is not ready to quit. This is what can happen in that case. I'm not really ready to quit. I just can't do it.
Okay, I hear you, Mr. Martinez. Do you mind telling me why you're not ready?
Well, I'm under a lot of stress, you know? I'm taking so many meds for my diabetes, so the smoking really helps me control all the stress.
I can understand why you feel that way. It must be hard managing the diabetes. But you know, smoking actually causes more stress on your body. The nicotine from smoking actually increases your blood pressure and your blood sugar levels. I would really encourage you to start taking non-smoking breaks. Do something besides smoking that helps you de-stress. What are some things that you like doing for relaxation?
Well, I really like to go on long walks by the lake, especially with my wife. She thinks it's really romantic.
That's great, Mr. Martinez. I'm all for romance. And I'm very happy to hear you have other healthy things that can help you with your stress. When you get cravings, try and focus on other things that you enjoy. I think you'll start to feel better, like you can enjoy a life without cigarettes. We'll talk again during your next visit, and maybe you'll be ready to consider quitting then. We've got some great tools to help when you are ready.
Wow, Dr. Bailey did a great job handling that, didn't she? Now, let's consider. What if the patients want to quit but don't want to be referred at all? One of the best resources for a patient who might not be ready to quit is the yesquit.org website. A provider can easily direct a patient to this web-based source of information with no commitment. The provider can also talk with the patient about other treatment options, like prescription nicotine replacement therapy, or over-the-counter options like nicotine gum or the patch.
Keep in mind that everything that we've talked about may have to be modified depending on the target population. For example, providers dealing with adolescents who smoke may face different risks and roadblocks, and so different information related to tobacco use may be relevant for that population. Let's see how Nurse Amy discusses tobacco use with Ben, a teen who visits the nurse's office at school.
So, Ben, why do you think you're having so many asthma attacks lately?
I don't know.
You can be honest with me. It's okay. Is there anything new going on with you? I see there is a note in your file that you were in-school suspension for vaping on campus.
Well, yeah, totally unfair. It's not like it was a cigarette or pot.
Ah, okay. But that's the new policy. And it is pretty bad for you, too. Did you know that the electronic cigarettes have as much nicotine as a whole pack of cigarettes? They also contain many harmful ingredients, like cancer-causing chemicals and bits of metal that can get stuck in your lungs.
Yeah, I didn't know about all that, but I use the safer ones, the ones without nicotine. I mean, I know smoking is bad. I want to be cool, but I don't want to get hooked.
I have to tell you that even the products that say they're nicotine-free often have some, and all the other harmful ingredients. You may still be getting enough nicotine to cause changes to your brain and even get you hooked. That's not so cool. So do all your friends smoke? Vape?
Some of them vape, yeah, but my girlfriend hates it.
Aha! Why not quit for her then?
Yeah, I guess I should try. But maybe she should try getting used to it.
Ben, is that fair though? Come on, you know the secondhand smoke from e-cigarettes is an aerosol that can harm those around you, which is probably another reason she doesn't like it, right?
Yeah, Nurse Amy, I totally know it's not good for me or her, but all my friends do it.
What about your friends on the football team? I can't believe that they smoke too, with those long practices you guys have every day.
No, you're right. Coach doesn't tolerate smoking.
I know you were really hoping for a spot on the varsity team this year, Ben. With your girlfriend and football in mind, how about you try quitting? Just this week, no e-cigarettes. See how your girlfriend feels, and whether your asthma attacks go down a bit. See if your performance out on the field improves. See me in a week, and let's talk then. Deal?
Wow, you make a tough bargain, Nurse Amy. Yeah, I'll try.
There's also a program called the Texas Quit Line that could help you. It is free and completely private. The Quit Line is phone or online coaching to help you quit. You can use the phone here to enroll.
I don't want to enroll in any program. My folks don't know, and I'm not telling them.
They don't have to know for you to enroll in the program. since the Quit line doesn't offer medication to anyone under 18 years old. They will call you 5 times to talk about how your quitting is going. You can also call them anytime you need help. It can't hurt, right?
Yeah, fine. It might help. The Texas Quit line can help different patients with different types of tobacco use issues and motivations. Just remember that counseling is free for Texas residents aged 13 and over. Counseling and nicotine replacement therapy is available to residents age 18 and over who are referred by a provider.
Remember, you're a vital part of the patient's quitting process. If your patient smokes or uses tobacco, please motivate your patient to quit. Discuss the risks of tobacco use and the benefits of cessation, especially as they relate to the reason for the patient's visit, like Mr. Martinez's diabetes. EHRs can make assessing patients' tobacco cessation needs as easy as possible if the eTobacco template is integrated in your system. But remember, not all EHR programs are the same, and some may require timely updates. Be sure the eTobacco templates are maintained at each system update. And finally, remember to address tobacco use at every visit. With the help of the Tobacco Intervention Template, we're one step closer to reducing readmission rates. Now we know how to use the Tobacco Intervention Template, and we're ready to
Ask, advise,
and refer our patients at every visit.
Woohoo!